My name is James Crawford Jr., and I'm chairperson for Be More Housing for All. Um, why single payer? Well, if we'd have had single payer when I was in an accident, I would not have lost my home. I would not have had to use my life savings, and I would not have become homeless. With single payer, I would have been able to keep all those things and still get the services that I need. Uh, I was hit by a tractor trailer. My job moved out of state, and when they moved out of state, I lost my insurance coverage. After that, I had to take my savings and pay for my medical needs. I had to sell my house in order to pay for my medical needs, and as a result of those things, I became homeless. And I stayed out on the streets for 3 years until I could get in a position where I can get some help from the safety net programs. I listen to a lot of politicians talk about, we don't want the way Canada has their health care because they have to wait for surgery. Well, the only surgery they have to wait for is elective surgery. I have never heard anyone from Canada come down here and say they want the type of insurance that Americans have, because our insurance is more expensive than any other country in the world, and we get less service for that. And in Maryland, we had a chance to pass the single-payer health care bill 2 years in a row, and it didn't work. But if we were to do that, that would provide health care for the whole state. And we have a lot of people that need that health care. We have a lot of veterans that are coming home that are not qualified for the services at the VA. But if they don't get some service from somewhere, they're not, they're going to be in terrible shape. So I look at single payer health care not only as being a savings for the country, but it would also, for Maryland, it would also be saving lives. I think that when we look at single payer, it wouldn't be a tax. What it would be is a premium, like the premium you're paying for your insurance right now, but all that would go into the one pot, and it's not a tax. And what will happen is we'll get to cover everybody in Maryland, and your premium would actually go down at the same time. So for us to keep this barbaric system that we have right now in place, it's only going to endanger more and more of the citizens of Maryland. I think what we need to do is get after the politicians and tell them, for the good of the state and for the good of the people, let's pass this single-payer health care bill.